So good afternoon. My name is John Madigan. I'm the Senior Vice President and Chief Public Policy Officer for the American Foundation for Suicide Prevention. I'd like to welcome you to the second set of focus sessions, and we have two extremely interesting guests today. The topic at hand is Suicide Crisis Intervention Services, okay? So we have Dr. John Draper, who is the Executive Director of the Suicide Prevention Lifeline, and Ashley Womble, who's the Head of Communication for the Crisis Text Line. We have a half hour for this high-level 10,000-foot look. So each of the speakers will speak for about 10 minutes. John will speak first, Ashley speaks second, and then I will do a Q&A with the audience. I'd ask you to stand up, let us know who you are, what chapter you're from, clearly enunciate your question, and I'll repeat it back into the microphone because with the technology we have, they can't record what's going on from the audience. So listen and learn. This is obviously a very critical topic for all of us. The last session was on workforce shortages. So this one is another piece of the puzzle on how do we deal with people who are in suicidal ideation. And these two folks represent two terrific organizations that are making obviously life-saving contributions to our nation. So John Draper, come on up. I'll let you know when you have 5 minutes.
Okay. Thanks, John. Thank you all. So I'm particularly interested in hearing your questions, what it is that you want to hear and hear me talk about. So I'll give you just a few kind of higher level facts, perhaps figures about the Lifeline and really how we operate. First of all, it's not just answering calls. It's also a chat service. There's an online chat service that is 24/7. It doesn't have as much capacity as our crisis call center capacity does, primarily because chat services have not been funded at the level of crisis calls yet. I mean, most of our centers have been receiving some kind of funding for answering calls for decades. Chat is still a relatively new technology. You'll hear Ashley talk about another relatively new technology used for crisis services with text. But chat is an online means very similar to what the crisis text line does in terms of providing digital response for people who much prefer to quietly seek crisis services and not talk with somebody. So we get about 200,000 chats answered a year, which again is considerably less than what we do with the crisis line. Crisis line, as I mentioned earlier, between the Veterans Crisis Line and the Lifeline last year, about 2.2 million calls answered. So what I think is still unclear to some people, but I don't think anybody in this room is unclear about it anymore, is that it's not a national call center, that it's really about local call centers. And why that's important, just like 911 wants to route people to the nearest 911 service, our crisis service, when you dial 1-800-273-8255, it really intends on getting you as close to where the situation is happening in your life, primarily because if you need referrals or you need a response from 911 or a mobile crisis team, it gives us a lot greater efficiency in making those connections. But another thing that I think is really important for people to know is our crisis centers are all signed on to the mission of suicide prevention. Many of you have worked with your local crisis center and the Lifeline network and know that this is what they do in their communities 24/7. That's particularly important for us because rather than being a centrally located crisis call center, we have a means of communicating to an army of suicide prevention specialists in communities what the best practices are, so they in turn can communicate it and inculcate it in the services, schools, senior centers, and community mental health centers in your area. So in fact, about a little over 80% of all of our centers do training in their community, gatekeeper training. So they're doing much of what the chapters are doing. I know many of the chapters here are engaged in training, gatekeeper training, as well as education. So that's also what our Lifeline centers are doing. So it's an opportunity for you all to be aware that you could be partnering and being force multipliers in this effort. As you're training, so could they, and they could use some of the trainings that you're providing and vice versa. So again, more suicide prevention voices in our community through the partnerships between AFSP chapters and Lifeline crisis centers. The other thing I think it's important to know is that when people call the Lifeline, the people that are answering, the counselors, are part of an accredited call center, but most importantly, that they have been trained in the best practices that have been based on what the evidence and evaluations related to Lifeline centers has been demonstrating. So really since 2002, there's been ongoing evaluations of Lifeline crisis centers by top experts in suicide prevention. Dr. Madeline Gould, Brian Mishara, and others have been doing this research and have given us information about not only what we're doing right, but also what we could be doing better. And so we've been improving our standards and practices really since 2005 when we began to get those results. And what we've learned is that there's some very important best practices. First and foremost is establishing rapport, so the person feels understood, listened to, and at that point, we're better able to collaborate with them as well as assess the nature and severity of their problem. So it is about establishing rapport and a good connection. It is about assessing the nature and severity of their risk as well as whatever mental health issue they're going through. Thirdly, it's about collaborating with them. They're the partners. Basically, we're in the passenger seat. They're the drivers. So our job is to work with them and help them drive towards a destination that will help them stay safe. And the fourth thing is really linking them to services or following up with them and doing whatever we can to keep them safe. And in many cases, about 80% of our crisis centers do follow-up for callers. So it's not just calls in, it's also calls out. And the evidence has shown that those follow-up calls can save lives. And most of the time, they're not paid to do those follow-up calls. Much of what our crisis centers are doing, in fact, is not paid for. As I mentioned, about 60% of the Lifeline crisis centers are not getting paid to answer Lifeline calls. They get paid to answer their local calls from their local county line that they might be answering or the other 10 or 15 lines that they're answering. But right now, the federal funding does not specifically cover the funding of local crisis centers. It does pay for our national chat centers. It does pay for our national backup centers. But local calls, because these are individuals who can and should be handled locally, is right now under the purview of state and local funders. And many of them don't know that these Lifeline calls that are coming through are callers that they need to be responsible for. So what you've seen here in your packets, hopefully you all pick up one of these, it's a really good example of an opportunity for partnership locally. And what this is an explanation of how the Lifeline works. It's how calls can and should be answered in-state, and if they're not, what happens to them? Who's answering the calls in-state? And if they're not being answered in-state, who could be answering them out of the state? What's the advantages of answering in-state? So all of that is here. And it's noted, again, the things that I mentioned before about local crisis resources being more available, greater efficiencies, as well as, again, having more ambassadors for suicide prevention locally. So on the back, you'll also see who is it that you can and should be partnering with. If you haven't reached out to your local crisis center, talk with them, not just about how you can help them get more funding and resources to answer Lifeline calls, but also how, again, you can be force multipliers. What is it that you're doing? What is it that they're doing that you could help each other with? So that your first call is not necessarily locally to a state senator or congressperson. It's really to the Lifeline Center or centers and say, how can we help? Because they could have a number of ideas and you could have a number of ideas. Many of you have quite a number of people who've been energized by your walks, who are really engaged and want to do more. And this is an opportunity, if for some reason you're not able to accommodate them in any of your chapter's activities, you can turn to the crisis center and say, could you use a few more volunteers? Could you use a few more voices? So remember that your local crisis center, Lifeline, needs your help. As you give other people the Lifeline Crisis Center information, or give them the Lifeline number, know that as you give them the Lifeline number, there's ways that you can help them help the people that you're concerned about. So we'll have Q&A in just a little bit. Ashley?
Thanks, John. I'm Ashley Womble. I'm with Crisis Text Line, and I was just informed that everyone has a 2-page brochure in your packet about the Crisis Text Line, so just read that. No, I'm just kidding. I'm really happy to be here to talk about Crisis Text Line. It's an organization, a nonprofit organization that's really run like a tech company, and we've been around for just over, getting close to 6 years. And the technology that we use is the same technology I bet every single person in here uses every day, and probably even during the time I'm talking, you'll get a text or send one, probably like, this is the best one, you guys should be in this room. And I really want to spend my time talking about how Crisis Text Line operates, and especially how our crisis counselors answer texts in our data. So I'm going to I'm going to start by explaining what happens when you send a text to 741-741. So when you send a text in, and you may see sometimes like a keyword, like talk or connect or something like that. You don't have to have a keyword in order to contact Crisis Text Line. You can just say whatever's going on. That just helps us track for marketing purposes, and also so that our partners like AFSP can find out who is using the code that we gave them. So definitely use that code and promote it and let everyone know that they can text, but it's not critical. Like, you can still send a text message. Once you do that, your message is going to be answered by a crisis counselor. They're not the first person that sees that message, though. Whenever you send a message, because it's all text, it will be first read by an algorithm, which I'm not the person to explain to you how that algorithm works, but I can tell you that it works a lot like a hospital emergency room. So if you have a gunshot wound and you need to go into the ER, you're going to be seen before the person with a sprained ankle, right? And so that's how our queue works as well. So based on that message, first of all, the first message you get is going to be automated. It's going to say, you've reached Crisis Text Line. We're finding someone to chat with you. Depending on our queue and depending on your crisis, you will be responded to within 30 seconds to 5 minutes. But we do handle the vast majority of all texts within 5 minutes, or begin those conversations, I should say. Things don't usually get handled in 5 minutes or 30 seconds. That would be a miracle. Whenever you text in, it can be about whatever's going on in your life. If it's a crisis to you, it's a crisis to us. A supervisor will be on the platform, and that's someone with a master's degree in psychology or social work, or another master's level clinician, reading all of the text message. Their platform view actually looks like you've won all the cards in Monopoly. They're going to be checking those conversations to see kind of how the crisis counselor is doing. Our crisis counselors also offer support where they need it, and say, it looks like you can, you may need to talk more about safety planning with this particular crisis counselor. The reason we have supervisors is because all of our crisis counselors are volunteers. They don't just log on one day randomly. They go through a background check and a 34-hour training. Our CEO and founder likes to say, because I think it's true, that it's actually harder to get into crisis. It's harder to become a crisis counselor at Crisis Text Line than it is to get into most universities, which is saying something. So all of our crisis counselors really have gone through a lot of training to focus on collaborative problem solving, risk assessment, and other crisis interventions. Active listening, that's a big one. We've trained over 22,000 crisis counselors right now, and the reason we do that is so that's twofold. So one, we have crisis counselors on the platform who can answer texts any time of day, and then also because they're now like advocates. They've learned all of these amazing skills and can be out in the community helping people IRL. Let's emergency. So that's basically how the platform works. One of the really interesting things about Crisis Text Line is our data. Because of the nature of texting, if you look at your phone right now, you're going to see a long transcript, right? You may not think of it like that, but a machine learning engineer would think of it like that. And it's enabled us to create a website called crisistrends.org, where you can find out what are the issues that texters are texting about in your state. I happened to pull a few data points before about suicide prevention, and just when people text us about suicide, 53% of people who text us about suicide are under the age of 17. The most texts about suicide come from Utah, Montana, and Idaho. We get the fewest from the New York tri-state area. And then, despite the myth that people end their life around the holidays, we don't see an increase in texts about suicide in November and December. We actually see a lot in April and October. I really encourage everyone to go to crisistrends.org to check out what's going on in your state. We also take conversations, as I said, about any crisis. So you'll also find out what people, what are people texting in about whenever they mention depression, what else is going to come up. You'll see a little word cloud as well. Let's see. All right, getting to the questions that John had for me. One is, how is Crisis Text Line funded? This is one of the most, I think, important distinctions between us and the Lifeline, is that we are, we get most all of our money is through major foundations like Melinda Gates Foundation, and through paid partnerships with organizations or companies like YouTube, which frees up your dollars to go to crisis centers in your area. We really are not looking for money. That's I'm probably the only person who can say that today in Washington, D.C. We're not looking for money. What we are looking for is your advocacy. So the thing that we really need is for people to know about Crisis Text Line, for them to know that people can text 741-741. You don't even have to know what your issue is. You just need to know that someone's there to help you. One thing that's very specific about what you should talk to your representatives about is tomorrow, Senator John Kennedy from Louisiana and Doug Jones from Alabama will be introducing a bill. Fingers crossed, right? You never know for sure until the day of. To require universities to include Crisis Text Line and the National Suicide Prevention Lifeline number on the back of student ID cards. This is real. Okay, see, big deal, right? And that's because it's been a while. I'm looking around the room. It's been a while since all of us were at university, I think. But you can use your ID card for everything, right? You use your ID card to get your lunch. You get your ID card to get into the gym. And if you need, if you're in crisis, which 75% of all of our texters are under the age of 24, you should be able to get help immediately. And so having these numbers on the back of student ID cards is really going to be a huge thing. So as soon as this legislation is introduced, I really encourage everyone to reach out and contact their representatives to say, let's pass this bill. And then the other thing that I think that would be so great is if people spread our number, make sure that people know that we're here. And if you have some extra time each week and you want to really make an impact, become a crisis counselor. You can learn how to do that online. CrisisTextLine.org.
Okay, Ashley, thank you very much. I think I've been in suicide prevention for 10 years now professionally, and I didn't really know much about your organization until I visited your headquarters in New York last year. So I think you're right. The biggest message is we're here, we're a big part of what's going on, and how do we complement the suicide prevention lifeline, and how can we work together? And right now, with you guys having funding totally outside the government, that makes it a very easy, it's educating versus asking for money. But again, you guys need to talk all the time, and as we develop new systems, we have to make sure that everyone's talking and knowing what's going on. So with that said, once you guys come back up, I've got to interpret the questions from the audience. So again, if you'll please stand up, and I have a hearing loss, so if you'll come a little bit up to the front, Tell us your name, and and give us your question, then I'll repeat the question back into the microphone so that the folks that are online can hear. So what kinds of questions might you have? Come on up. It's like come down to Price is Right.
My name's Kellen. I'm with the Eastern Missouri chapter. I live in St. Louis, Missouri. My question is just kind of if the two of you could look into the future in a perfect world with this very exciting possible 3-digit number for the Lifeline, how would you guys partner then for the text line as well? I mean, could we look at something? I know, again, it's been a while since I've been to college, so I'm not as much of a texter. I still like to talk on the phone, but I know that they're all 741, 741. They're 6 digits. Could we somehow maybe in the future combine those to where it's you can call, you can text to the same, so it's cohesive?
Okay, so I'm going to boil the question down. The questioners asked, looking into the crystal ball, how might things look in the future, especially if we get an N11 number, and is there a possibility of combining everything into the same area? So you guys take it away.
So the research is pretty good on this and asking young people what they would prefer. Would you rather text? Would you rather phone? Would you rather chat? So they did a study on this about 4 years ago. It was recently published about 2 years ago of high-risk youth. And essentially what they came away with is, we need to provide all 3 of these things. It's not, no, they should just be getting this. No, there was enough people saying, I really like phone, I like text, I like chat. And in spite of the fact that we hear that kids these days don't text, 40% of the people that contact us are under 35, and about 25% are under 25. So there's still a significant number. But the idea of having a unified platform that enables us to do everything, that gives people those choices that they need, I think is important. So I think that's really why folks like Ashley and her colleagues at CTL and us and Trevor and others need to be working closely to say, how do we bring together our resources as much as possible so people get the choice that they need? I shouldn't have to just phone. I shouldn't have to just text. We need to be able to have this open all doors and all windows for anybody having any kind of crisis and communicate in any way that they need to be.
Yeah, I think it's a really interesting question, and certainly something that both of our that we're all thinking about. How will we work together if this 3-digit number passes, or if there's funding for it? But I think it's important to think about some of the other differences besides the fact that there's both digits, right, in our organization. So as John was talking about, whenever you call the Lifeline, you're connected to someone in your area, right? Whenever you text Crisis Text Line, you could be texting in DC, and someone in Oregon would be the crisis counselor who responds to your text message. And so I don't think that that's necessarily a barrier. I just think that there are a lot of things to think through before, there's a lot of things to think through. I'll leave it at that.
I would add, John mentioned the Trevor Project. Again, you heard this morning when John talked about the Lifeline during the lightning round. If you're a veteran, you can hit 1 and you get transferred to the Veterans Crisis Line. The Trevor Project, how many of you are familiar with that? That's an LGBTQ youth project that has a hotline, and I think they do text. Don't they do both? So they're willing to jump in, looking in the crystal ball, that perhaps if you call whatever the number is, if you're a veteran, you'd hit 1. If you're LGBTQ, you might hit 2. And if you're Native American, you might hit 3. I'm just sort of making stuff up because, again, there are some ideas out there. We just have to figure out. The bottom line right now, we've got to get the funding increase for the Lifeline, okay? It looks like things are real good. When I first met Ashley's boss, so I said, hey, it's great to meet you. What are your challenges? She goes, I don't have any. And I said, oh my God, can I videotape that? Because right now they're in a really good spot. They get lots of robust funding from Silicon Valley, right?
Yeah.
And the Melinda Gates Foundation. that could change. It may not change, but the good thing is, much to John's point, we need to have options and give people choices right now. Like I have a 26-year-old. I may have told some of you, she doesn't call me anymore. She just texts me. And then when I don't respond, like, Daddy, where are you? And I said, honey, I'm at work. I don't stare at my phone waiting for a text from you. So I've had to educate her, if it's an emergency, you need to call me at the office or whatever. So I think again, bottom line, we got to have opportunities for people at different levels, whether we're older and we use the landline still, or we're younger and we just text. All right, next.
Our landline guy over here.
Next question. Come on up and stand in the. Bear with my disability.
I'll be really loud. So the question for me is for those people who are, to me, they wear the tin hats on their heads, and they're nervous about data. So I wanted to find out from both the call perspective and the text perspective, what is your small elevator speech to reassure people that it's aggregated data that we're looking at, and that you can either.
Okay, so if I understand the question, you're asking what kind of data is being looked at in terms.
To make sure that it's aggregated, that what is their elevator speech that says, one line that says, don't worry, your individual info is not going.
Got it. Okay, so the question is, how is the data aggregated, and is people's personal data protected?
Yeah, I don't care how it's done, I just want to know a sentence that
Okay.
we can use,
Yeah, sure.
that we can use with politicians.
Yeah, great. That's a really good question, especially with all the privacy concerns that people are having more and more. And it's not just people who wear tinfoil hats, in fact, that are worried about them. I'm constantly, concerned about what I send to people using different services, as we all should be, really. But I think my speech is one, so we don't ask you for any information at all. We have your phone number, right? And that's it. So you can share with us whatever information you would like. We're not doing a survey. We're not going to try. We do surveys, but they're optional. And then the other part of that is that it is aggregated data and it is anonymized. And it's only available in like wide swaths. Like one of the questions I feel like people are going to ask is, what about my county? And we actually don't provide information at that level. We don't get that granular. And so all the information that people share with us, it's anonymous and private. And we don't sell it. Like that's the number one thing.
And really, same thing with the Lifeline. It's anonymous. We don't ask for people's names. But another way of thinking about it is it's actually more anonymous and confidential than your doctor's records. Your doctor's records, they have your name, they have all your conditions, and all your diagnoses. That is not what we have. We don't have your name, we have your phone number, and we have your problem for the day, and it's all aggregated. So it's actually, in that if you're worried about privacy, it's actually more private in that respect.
Okay, next question. These are great questions. Any questions from the virtual audience? Yes, sir.
You want to phone in on the landline for this question?
Yeah, that's what I was just going to say. I use my landline. Why don't you sell the data and give the money to Lifeline? That's not my question.
But it's a good question. Why don't you answer it?
I think that's a brilliant idea about the college ID. How could we maybe get a friendly senator or so to get a bill to get him on a license?
Yeah, I think that's the
Great.
next step.
Okay, so the next question is,
Fit right here.
yeah, it looks like Senator Kennedy from Louisiana and Senator Jones from Alabama are introducing a bill tomorrow that's going to call for the placement of the Lifeline number and the text line number on college ID. So the question, a very good question, is why couldn't we get that on all state licenses? I have an answer, but why don't you guys give it?
I think it's a great idea. But then again, if the FCC were to provide a 3-digit number for the Lifeline, because is 911 on the back of our license? I'm not sure. But I guess the reason is because it's so ubiquitous that people know. You don't need to put it on the back of a license. That would be ideal. So even kids who don't have a driver's license yet could say, oh yeah, there's that 611 number. So,
The thing is, if you're talking about a chat line and a lifeline,
yep.
and
Yep.
probably you're right that every almost child in America knows to pick up the phone and call 911 if mommy falls on the ground. But I still think
Yes.
it's a different dynamic
It
when
is.
you're talking about somebody in a mental health crisis
Yep.
or a suicidal crisis.
Yeah.
Okay.
Well, they can also text 911. I just want to say that they can also text 911 too sometimes, and I think it's important to have both those options. So some people may have read a couple weeks ago, we actually had a texter who and I can share this information only because it's been in the news, and I won't share the person's. I don't even have any other information besides what was reported in the news. That's how private our data is. But we had someone who was in a very unfortunate situation, who was was a victim of human trafficking and actually sex trafficking. And that person didn't feel that she could call 911, so she texted crisis text line. Now, we were working with her and also said, you can text 911, right? But I think it is important to have different options for different situations, because there's no way that person would have been able to pick up the phone and call 911 with men in the room with guns, right? So it's really important to have all that information. And I just want to add one thing about the LGBTQ population. So I think that one thing that we need to think about is the way that people identify in their sexuality doesn't necessarily have anything to do with why they might be in crisis. And so I just would want to keep that thought out there as we start to segment these audiences and have different buttons for different people.
All right, well, we have to close this session again, so thanks to John and Ashley. Perhaps they have a few minutes to go outside the room and answer any questions, and then we'll let you both know what we hear on Capitol Hill tomorrow.
Yes.
And we look forward to our work together.
Great.
All right, great, thank you.